One of the most common New Year's resolutions every year is to become healthy. This morning, we're going to talk about our liver and how to take care of it as we observe Liver Cancer and Viral Hepatitis Awareness and Prevention Month. Joining us now in the studio to give us some info and tips is Dr. Diana Payawal. She's the chairperson of the Cardinal Santos Medical Center Hepatology Committee. Good morning, Dr. Diana, and welcome to New Day.
Good morning, Doc Fred.
Now, viral hepatitis, liver cancer. Broad topic, marami tayong pag-uusapan. Let's start first with hepatitis. Marami tayong hepatitis. We have hepatitis A, B, C, we even have D and E. But let's talk about yung mga common one, the most common ones. Let's talk about A and B. Umpisa natin sa A. How do we get hepatitis A? How can we prevent hepatitis A?
Well, hepatitis A, first of all, is obtained from food. So if you are fond of eating in unhygienic places, so that actually becomes a risk for you to develop, to get hepatitis A. But the good thing about it, Dr. Freddy, is there is a vaccine. So you might as well get the vaccine. It's actually available. And it's because the Philippines is endemic for viral hepatitis A, it is routine for us to get it.
Okay, pag tayo nakapag-vaccine, doktora, ibig sabihin, wala nang problema kumain ng alanganing pagkain. Yes, kailangan pa rin maging careful.
Like now, there is a predominance of gastroenteritis in Baguio, and this is linked to norovirus.
Okay.
I think it's evident. I've seen about 4 or 5 new cases of acute gastroenteritis. So I think we should be very careful of what we eat.
Okay, so the vaccine is there to help, but we still have to be careful of what we eat. Now, hepatitis B, ano naman ito, doktora? Paano ito nakukuha? Anong pwedeng gawin?
So viral hepatitis B is quite a distinct disease because it is linked to liver cancer. And about 1 out of 10 Filipinos are infected with viral hepatitis. And that is why we celebrate Viral Hepatitis Day for month, actually, for January for the Philippines. Now, there is a vaccine that's a 016 months vaccine that you get, and it is mandatory for our newborns within 24 hours to get the vaccine itself. Therefore, it is PhilHealth deductible. You can get it from PhilHealth. There is no reason for your newborns not to get vaccinated.
Okay, now it's interesting that you mentioned that there's a link between chronic viral hepatitis B, kaya importanteng ma-vaccinate tayo with that, and liver cancer. So let's jump to that. Let's talk about liver cancer. Paano ba ito nag-uumpisa? Mararamdaman ba ng isang tao na nagkakaroon na siya ng problema with the liver, especially when it comes to cancer?
Okay, let's start with prevalence. I think this is very important. Liver cancer is actually the 5th. It is actually after breast, lung, colon, and liver. But what is surprising, it is the 2nd most common cause of mortality. So the survival rate for liver cancer is about 35%. And therefore, it's important for us to find it out. Now, how do you get it? Unfortunately, the liver is a huge organ in the body, yet it does not complain much. So you need to identify patients who have the risk. So ano ba ho ito? Those who have viral hepatitis. Now, the prevalence now is fatty liver disease. Non-alcoholic fatty liver disease or metabolic associated fatty liver disease, which we in the APASL, Asia Pacific Study of the Liver, is now looking into. Now, it is now as viral hepatitis is going down because of vaccination, it is actually, and because the WHO recommends us to eradicate viral hepatitis by 2030. And therefore, there are numerous steps, both from the government and the private sectors, to actually help eradicate viral hepatitis. But as this is going down, metabolic associated fatty liver disease is becoming a problem.
At anong pinaka-main risk factor nito?
Diabetes, obesity. There are patients who actually have the metabolic syndrome. So ito po ay link now to to liver cancer.
How big is the influence? Because a lot of our viewers, when they hear liver cancer, problema sa atay, it's always linked to alcohol drinking.
Yes. Thank you for mentioning that. Unfortunately, alcohol is now becoming rampant, as I mentioned. And this is something that is seen, even our young individuals. You can see when you go to the bars, there are young, less than even, and even in the community, children. We have a data now, it is as said, that even those with less than 4 to less than grade 8 or 9, those in the high school, actually do drink, no? And some are tolerated in the household.
So these are binge drinkers. So hindi lang yung manginginom talaga, yung mga tomador, hindi lang silang risk for liver cancer.
We used to think that if you chronically drink, you're linked to liver cancer. But now there's data that we have published that binge drinking is also linked to patients who do develop chronic liver disease.
Okay, so sometimes they say in moderation, but in this case, mas maganda yung nanatol.
The apostle recommends no drinking.
Okay.
And even the being the immediate past president of the Philippine College of Physicians, we recommend, just like no smoking, no drinking.
Okay, so there you have it from the experts. Now, Doktora, the general theme of the observance is malusog na atay, masayang buhay. Can you give us some tips naman overall? Because our main goal here is how to keep our liver healthy. How can our viewers keep their liver healthy at this point?
Just like all other diseases, it is actually regular exercise and the right food to eat. Now, we have said that diabetes is linked, therefore you have to get yourself checked. Those with comorbidities like diabetes, high cholesterol, these are linked with metabolic-associated fatty liver disease. Now, if you have viral hepatitis, please get in touch with your gastroenterologist or hepatologist or even your internal medicine specialist to get yourself treated and monitored.
Is there something specific with regards to food, Doktora, na talagang specifically sa atay magiging healthy pag kinain natin to?
Magiging healthy. I thought you were going to say the other way around. So we, of course, do not like you to eat a lot of fats because it's linked to high cholesterol. And, of course, those with diabetes. So siguro those that are recommended is fruits and vegetables. I think that's Mediterranean diet has always been linked to good
Ayun, Mediterranean diet. So it's more of dapat iwasan ng matataba, high cholesterol, high fat.
Fruits and vegetables.
Thank you so much again, Dr. Diana Payawal, for joining us this morning on New Day. Marami talaga tayong natutunan with you today.
Thank you, Freddie.